It has been estimated that nearly one-third of American adults, almost 98 million adults, have underlying prediabetes. It means they might have higher blood sugar levels than normal, but not too severe to be classified as type 2 diabetes. Medically, this condition is also known as impaired glucose tolerance or impaired fasting glucose. There are no clear signs of prediabetes, so you might have it without even knowing. But you can stop prediabetes from becoming type 2 diabetes by making some healthy choices and positive changes in your lifestyle. That's what we're going to learn in this video. If you're getting tested for prediabetes, pay attention to these three key results. Number 1, your HbA1c levels. This test is used to measure your average blood sugar level over the past 2 to 3 months. If your A1C is between 5.7% and 6.4%, it could indicate prediabetes. Number 2, fasting blood sugar. Measure your blood sugar level at least 8 hours before you eat or drink anything. If your fasting blood sugar is between 100 and 125 units, it could indicate prediabetes. Number 3, OGTT 2-hour blood sugar. This test measures your blood sugar level 2 hours after you drink a sugary drink. If your OGTT 2-hour blood sugar is between 140 and 199 units, it could indicate prediabetes. Prediabetes is often called a silent condition because it usually has no symptoms. You may have prediabetes for several years without even knowing it. Certain risk factors like being overweight, being older than 45 years, having hypertension or high blood pressure, or having a family history of diabetes may increase your risk of developing prediabetes or type 2 diabetes. So if you suspect you have prediabetes and want to prevent it from becoming diabetes, follow these simple and easy steps. Number 1, eat a clean diet. Eating lots of processed foods, especially the ones packed with unhealthy stuff like saturated fats, extra calories, and added sugar, can increase your risk of developing prediabetes. But don't worry, eating a clean diet, which means choosing healthier options like fruits, veggies, and whole grains, can help get your blood sugar back on track. This can even help reverse prediabetes and prevent you from getting type 2 diabetes in the first place. Take help from your healthcare expert or a registered dietitian to make a balanced diet plan comprising complex carbs, vegetables, lean meats, whole grains, and healthy fats. More importantly, track your carbohydrate intake and blood sugar levels to ensure you stay within recommended limits. Number 2, exercise regularly. Let's talk about exercise and how it can help you avoid or maybe even reverse prediabetes. Not moving enough can increase your risk of this condition. But regular exercise isn't just about feeling energized and boosting your mood, it can lower your blood sugar levels too. Regular exercise can gradually make your body more sensitive to insulin. This means your cells can respond to insulin more efficiently and utilize the glucose in your blood more effectively, helping to keep your blood sugar levels in check. In fact, one research from the American Diabetes Association says that exercise can help regulate your blood sugar for up to 24 hours after a workout. So, how much exercise should you do? Well, the American Diabetes Association recommends aiming for 30 to 60 minutes of moderate-intensity physical activity at least 5 days a week. That may sound like a lot, but the good news is you can break it down. Start with short bursts of light activity, like a 15-minute walk or a 20-minute bike ride. As you get more comfortable, you can gradually increase the intensity and duration of your workouts. And don't worry, there are plenty of fun activities that count as exercise: walking, biking, jogging, swimming, aerobics, and playing sports. Number 3, lose excess weight. A balanced diet and regular exercise can help you to reduce unwanted pounds and improve your blood sugar levels. Even losing a small amount of extra weight, around 5 to 10% of your body fat, can make a big difference in your health. In fact, for some people, that could be as little as 10 to 20 pounds. And here's another interesting fact. Having a wider waistline, about 35 inches or more for women and 40 inches or more for men, can lead to increased insulin resistance, which can make it harder for your body to utilize blood sugar for energy. Another helpful tip if you have prediabetes is, instead of 3 large meals, try spreading your meals throughout the day by eating 5 or 6 smaller portions. This can help you feel fuller for longer and avoid overeating. Number 4. Stop smoking. We all know smoking is bad for our hearts and lungs, but did you know it can also mess with your blood sugar and increase your risk of developing prediabetes or type 2 diabetes? That's right. But don't worry, there are plenty of resources available to help you succeed. Over-the-counter products like nicotine patches and gum can help lower your cravings and make quitting a bit easier. If you need extra support, talk to your doctor about smoking cessation programs or prescription medications that can help curb those nicotine urges. Number 5. Eat fewer carbs. Even if you're habitual in clean eating, it's important to pay attention when it comes to carbs, especially if you're trying to reverse prediabetes. Focus on eating more complex carbs. These are basically unprocessed carbs that keep you feeling full and satisfied for longer. Think vegetables, whole grains, and beans. They're packed with fiber, which slows down the release of sugar into your bloodstream, preventing those unwanted spikes in blood sugar. On the other hand, simple carbs get absorbed quickly and can raise your blood sugar too much and really fast. Foods and drinks that contain added sugar, candies, sweet yogurt, honey, many commercial fruit juices and energy drinks, and some fruits like mangoes fall into this category. Limit your intake of these types of carbs. Another very common type is refined carbs. These are basically processed versions of carbs like white rice, white bread, pizza dough, pasta, and breakfast cereals. These processed refined carbs are usually deprived of their good stuff like nutrients and fiber. What you're left with are empty calories coming from starch, which is a type of sugar that can raise your blood sugar levels. To keep your blood sugar balanced and reverse prediabetes, it's best to limit or even avoid these refined carbs altogether. Number 6. Get yourself treated if you have sleep apnea. One 2021 study showed that people who had obstructive sleep apnea had a 71% increased risk of type 2 diabetes. On the other hand, one 2020 study showed that treating sleep apnea in individuals with type 2 diabetes significantly improved blood sugar control. Studies show that the relation between sleep apnea and type 2 diabetes is bidirectional, meaning one condition can lead to another. Sleep apnea disrupts proper sleep patterns, leading to reduced oxygen levels and increased stress hormones. These factors can lead to insulin resistance, chronic inflammation, interrupted glucose metabolism, weight gain, higher blood pressure, increased appetite, and even cravings for unhealthy foods. So if you have sleep apnea, prediabetes, or both, consult your healthcare expert for proper treatment to prevent any further complications. Number 7. Drink more water. Staying hydrated can help keep your blood sugar at a healthy level. Water helps to keep your blood diluted, making it easier for your body to carry glucose from the bloodstream to your cells, where it's used for energy. It also triggers your kidneys to flush out extra sugar from your blood via urine. This can help keep your blood sugar levels stable, preventing those unwanted spikes and crashes. So always respond to your thirst signals and keep yourself well hydrated. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.